Judith Collins is with us this morning. Good morning.
Thanks good morning, Tim, and Happy New Year.
Happy New Year. Let's hope it is. People working at the border obviously are very exposed. What are you saying here? Someone is inevitably going to get it?
Well, that's what's happened before, hasn't it? And that's pretty clear how community transmission starts. The government told us on the 16th of November, they told the public that New Zealand was at the front of the queue for these vaccines, and clearly that's not true, because we've got our MIQ, or our border staff, who are not vaccinated at the moment. We've got our healthcare workers and those who work in aged care, who should be our priority people for vaccines. The government needs to just get moving and get those people protected. Not only them protected, but obviously when they go home at night, they can spread a disease or, the virus to their families, and that's how it gets out.
We were originally told it would be the first quarter that we would see the jabs. We're told we've got deals with all the companies producing them. Is there an availability issue? Has there been any explanation as to why this has slipped?
No, the government has been silent on why this has occurred. Very clearly, Chris Hipkins, the Minister of Health, said New Zealand will be at the front of the queue, and that was 16th of November. 2 months later, we've got Canada saying that they have 5 times the amount of vaccine that they need to immunise their entire population. We have other countries rolling out the vaccination, particularly for those frontline and most vulnerable staff, and we've got the New Zealand government saying, well, maybe we'll start it in possibly April. Well, that's simply not good enough. They need to protect those staff straight away.
MedSafe is a player in all of this because obviously it has that regulatory power. It says it's prioritising COVID vaccine over everything else. Should we be skipping that process if it's already been done elsewhere?
Well, it does seem something I think that MedSafe could explain a little bit more about, because what it is that they're doing that hasn't already been done in the UK, the Oxford vaccine and also the Pfizer vaccine have been now widely rolled out in countries that we compare ourselves with. It does seem all a bit slow, really. And then we've got the Australians saying that they will have 4 million people immunised by April, end of March rather, and we've got New Zealand saying, well, we'll get around to looking at the border staff in April and maybe everyone else in July. It's too late, and we've got an enormous moat around us as a country with the oceans that we are, in, but none of that is going to save us if the border staff are unprotected and they get this infection.
It's not going to be mandatory for the average Joe and Janet in the street to have a jab. Should it be mandatory at the border for border workers?
Well, I think that's one of the issues that the government needs to consider very carefully. I would have thought that I can't imagine any border staff who work in what they work in terms of a highly infectious and dangerous situation will not want to have the vaccine. Quite clearly, anyone who understands how this virus transmits and so quickly and so insidiously would want to have that vaccine. I just can't imagine that those healthcare people don't want to have it.
If they don't, should they be told they can't work at the border?
Well, I think it's...
Given the significance and the fact that the border is our weak spot.
Well, I think it is a very important issue, and that's what the government needs to come back on. Clearly, they are the people in charge at the border, and I can't see any of those staff not wanting to do that. It's simply beggars belief that healthcare professionals wouldn't understand what vaccinations are all about.
Appreciate your time this morning. National Party leader Judith Collins at Newstalk ZB.